welcome back, and thank you so much, Dr. James Komolafe, for those very important mental health tips that you always give us. Now we're moving the conversation to appraise the final report of the Presidential Health Reform Committee. Does it really address those many issues within the health sector? That's what we'll be discussing, and we have Dr. Douglas Emeka Okor, health sector reform advocate, right here with us. He's been advocating for all of this, but is this the document, the Bible that we've been waiting for? Doc, thank you so much for being part of the program.
Thank you once again for having me at ASU TV.
It's always wonderful to have you.
Always a pleasure.
Always a pleasure having you.
I was saying that we are missing the Funaya, but we have a great gentleman here replacing her. So
thank you very much.
Okay, so yes, the document. First of all, it was the past administration that set up that committee. Do you think this administration would see it as important to move on with those reforms as the past? We know how it is when governments change.
Well, I think we've gotten to a point here in Nigeria now where whatever the administrations or whatever national, subnational, whatever they think, it's not really that important. It's okay. It's what do Nigerians think? Okay, what is the strata of Nigerians across board? What do they think? How much pressure are they ready to put on their governments and say, hey, we've looked at this. Oh, this we think will work. Oh, this is the agenda that we want to set for this or this. For example, for healthcare, what is the agenda that the average Nigerian, that all the strata, all the key players, all the strategic people within that are interested in healthcare, what agenda do you want to set? Is this document, for example, Joy, an important document to actually move healthcare forward? That's the key question. Not whether those are the president or the National Assembly, whether they're interested in or no. The Nigerians should set the agenda. They should be the ones putting pressure on these people to actually say, hey, political leaders, you need to actually focus on this. We need this to happen. So we should reverse our thinking, not asking whether they will be
okay. Now let's the question you just raised. Yes. You have studied the 300+ document,
320 pages,
320 pages document.
Yeah.
Does it really address and capture the needs of the Nigerian people when it comes to access to health?
It's an absolutely fantastic document. I'm almost pushing to say, oh, it's like a holy book or a Bible or a Quran. Do you understand? For healthcare reforms in Nigeria moving forward. It's a fantastic document. I think the former Vice President, Professor Yemi Osibajo, and the team, a 50-man committee, they did an absolutely fantastic job. Okay, no document can be 100% perfect. But when you look at the document and see what they try to do in terms of looking at the components and different programs and how they want to actually reform healthcare in Nigeria, wow, fantastic document. They actually did this work for almost 21 months. Yes. The committee was inaugurated on the 6th of September 2021. And then finally, 5 days before the inauguration of this present government, okay, they actually delivered the final report of the document. So, really solid document.
Well, I think the core target was for Nigerian healthcare system to meet the universal health coverage.
Absolutely.
Before this document, because I've engaged with you a couple of times and I know how deeply you understand the Nigerian healthcare system, and you've been advocating for reforms all in a number of areas. Just talk to us. Where were we before the committee was established as at 2021? And where do you think we could be if some of the recommendations were to be quickly and efficiently applied?
Okay, so we can look at it this way. We can look at the general healthcare indices, the way our institutions have been run generally, or we can actually go deeper and actually look at the basic components of a healthcare system itself and see, okay, when we actually break it down, there are usually 6 of them. Now and again, we tweak it a little bit. There are 6 of these components. If we look at each of these components, how were we doing before this report actually came on, before they did this fantastic work? Where are we now? Okay, because of course the report has not been implemented. And where are we hoping to be in the future? So let's break it down. What are these components? The first one is governance, healthcare governance, leadership and institutional reform. Okay. Second one is funding and healthcare financing reform. Third one is about health service delivery itself and redesigning it. Okay. Fourth one is about things like healthcare technologies and stuff like that, and then of course human resource for health. Okay, there are about six of them. So where were we before? We were struggling in all these components, all these pillars, all of them. There's no one that we can say, oh, okay, well, we are doing well in this one or stuff like that. We are not doing well in any one of them. And so that's why when the last government said, oh, let's get a committee together, let them actually sit down and do some groundbreaking work to actually review all these pillars, all these components of the healthcare system, and look at even some of the reviews or some of the reviews and reforms that have been done before, and say, okay, have they worked? Okay, why didn't they work? And actually try and put this document together to at least try and plan a way of how we can actually move forward in healthcare. Okay, so we were struggling previously. Now we have this document. We have other acts, legislations, policies and stuff that are also on ground that also been on ground before. Now what we need to do is to actually move forward. How do we actually take what's been on ground before, look at these documents, try and unify and actually integrate them properly, and actually look at the realities on ground in Nigeria and say, okay, what is the best way forward? How can we actually move forward? We're looking at this and looking at how we can actually reform healthcare this year and work the way forward. Good document, okay? We are still struggling with healthcare in Nigeria, looking at all the components. I'm hoping that all the key players can continue to put pressure, because that's an problem again. Whether it's because of we have the economic issues and people are really suffering and stuff like that, there's a tendency to always forget about healthcare, and it's only when families, patients, individuals, when they run into trouble, they now remember, oh, that's true, healthcare is important to Sustainable Development Goals. Okay, like they are doing the United Nations General Assembly now, and one of the key things they are trying to do is to push the Sustainable Development Goals, isn't it? Guess where number 3 is? Where the healthcare is? It's number 3. 1, 2, 3. It's that important. And also, when you look at this government and you look at their which was what they call it, 8-point agenda, like an 8-point agenda and stuff for their renewed hope. You didn't find the key issues of Human Development Index, okay? Health and education. They were not there. That is a massive miss, okay? That's a massive gap, okay? If you truly want to move people out of poverty, millions of people out of poverty, you must target education and healthcare. And guess what? Not even the big stuff, the basic stuff. Basic healthcare, basic education.
Now, okay, we keep talking about universal healthcare coverage, but where are we when we are even questioning the social register that was developed some months back? Where are we? We just keep talking basic, but where is the indices that will give us that confidence that we are indeed even moving?
You ask me very simple questions. I always give you very simple answers. We are struggling. We are nowhere. That's the truth. We are nowhere. One of the key things that I always use this phrase. Right. Serious government. We've not had serious governments in Nigeria for a very long time. I'm hoping that this government will be serious. Okay? We have not had serious governments. We've not had governments who can look at the country and say, hey, we need to do this. We need to pull this together and actually try and deliver this. When you talk about good governance, healthcare is a key priority in good governance. It is good. It's a fundamental key priority. Okay, and when you actually have a country where you have 133 million multidimensionally poor people, and now looking at the economy now, of course, that number is going to increase significantly, isn't it? It is. Okay, so it's going to be a struggle when you talk about accessing healthcare, and so governments must do some fundamental things about healthcare, and we are not going to leave it to them to have a light bulb moment as to whether they are going to be interested or not. No, right. We will put pressure on them. We will tell them, hey, you cannot do your 8-point agenda and forget healthcare and education. It doesn't work. That means you're not looking serious. Please, governments, national and subnational level, can you please be serious? Sometimes when you're on social media, you see people say, oh no, support the government. I want to support the government that looks serious. When you're serious and you're actually looking in terms of your body language, your posturing, that you want to actually do well for the people, people will support you, I promise you.
So what is that very first thing to do? We keep talking about universal health coverage, and there are a lot of people who are in the informal sector. I hear the most basic justification that we can't even, you don't even know where they are, they don't have addresses and all of that. If a government is serious, hypothetically speaking, what are those first steps that has to be done to bring these people to the dragnet? Okay, so we already have this document, isn't it? Yes. So the first thing is that they actually need to set up a committee or pull a group together and actually carry this document and sit down
with this document. This document is a really good document. They even got to a point where you actually have subcommittees.
Yes.
Okay, and the subcommittees actually looked at various things. Oh, what are the issues, and made far-reaching recommendations. They even made recommendations up to a point where they said, oh, this is even the timeline to achieve this one, and this is the person who's going to have the responsibility to actually make sure that this timeline is achieved. Okay, it's that good a document. So that's the first place they should start from. Okay, a document, work has been done with. Hey, these guys, 21 months of work. Okay, can you please not throw it into the dustbin? Exactly. Bring this document. At least now you don't have a new team. You have a minister of health. You have a minister for state for health. Okay, and they look like good guys. Okay, so one of the key things, if you look at, for example, you look at the minister for health, for example, look at his pedigree.
Yes.
Okay, look at the key issues in terms of his capacity, in terms of his technical capacity, his competence and stuff like that. Look at the issue of his passion, which is really important. Okay, someone who was actually given a job in Gavi. The Global Alliance for Vaccine, and he dropped that job. Imagine how much money would have been paid for that job. But he dropped that job to come and be Minister for Health. So it shows passion and that he wants to actually do well. Now, what is remaining? One thing I hope that he and his counterpart as Minister for State will have is courage. Courage. Because we've been used to doing things a particular way for a long time, and some people feel that they benefit from the way things are and stuff like that. Now, if you want to radically make changes to actually move these reforms that we want to say, that can actually put healthcare, okay, as a priority and actually move it, you need courage to actually make those things happen.
Courage.
Oh, you do. I'm telling you, if you want to make changes in a system like this, okay, there's this word that they call path. I forgot the word, but the word just means that usually people are so used to doing things a particular way that when you want to bring reforms into a system and actually make changes and look at saying, okay, how can we stop duplicating functions? How can we make things more efficient? How can we make things more effective? How can we stop wastage? How can we stop duplication of functions and stuff like that? Some people say, they want to remove food from my mouth and stuff like that. So it requires courage to actually make those changes. So like you asked, what are the first things to do? Take this document, dissect this document, and look at how can you actually look at some of the previous reforms. We already have the National Health Act, for example. Okay, where can you, how do you put the National Health Act, put this kind of reforms that have been proposed and stuff like that, say, okay, can we reform, can we go through the National Assembly again and look at some of the key issues and reform these things? Now, when you now produce a document, like a reform document, or get this National Health Act to a particular level, say, okay, this probably will work. Okay, you now get to work. Okay, you get to work. All the key players get to work. The first thing that they need to do is actually, first of all, show even in their actions, show first of all that Nigerians, as the president, as the Senate president, as the House of Representatives, as the governors, healthcare is important.
Exactly.
The reason I cannot see any body language from these guys that they should have made that healthcare is important in the first place. I cannot see any. That's the truth.
Well, Dr. Douglas, from my engagements with you, if there is anything that I know you've been passionate and calling everyone that cares to listen to, is that Nigerian patient matters.
Yes, Nigerian patients are worth it.
Are worth it.
Yes.
And if you look at the goal of the universal healthcare coverage, it's just to make healthcare accessible to all Nigerians at all times. And
at least basic healthcare.
At least basic healthcare. Because access is very important. And then, of course, payment for healthcare. Nigerians cough out from their pockets to pay for healthcare, despite the fact that before the National Health Act, which you mentioned, we used to have National Health Insurance Scheme, which was largely catering for the formal sector, whereas we have the larger percentage of Nigerian population in the informal sector. Of course, efforts are being made to co-opt them into the scheme, which is now an authority.
The key is that the efforts are not enough.
Exactly,
they are not serious.
The question, you've already answered my question, which is the change from National Health Insurance Scheme to National Health Insurance Authority, in order to give the agency that power,
that bite.
Exactly, to be able to deal directly with these HMOs and even the hospitals and other players within the mix, to be able to make healthcare accessible and to stop Nigerians from having to pay out of pocket for healthcare. Do you think this reform has some recommendations that will ensure that we at least have a semblance of this goal of at least ensuring that the Nigerian patient is put up there.
Absolutely, it does. Okay, like I said, they actually looked at these different components of healthcare. So, for example, we're talking about here funding and financing.
Exactly.
Okay, and trying to reform the funding and financing within Nigeria. One of the key problems we've had for a long time is that things are too fragmented. Okay, you have the state governments doing their own. There's a community health insurance scheme somewhere there. You understand, the national health is doing their own. No, we need to integrate these things. Okay, it is one. That's why we talk about this one health, isn't it? Yeah. It is one system. Okay, there are different parts of the system, but it's one system. You're not like an orchestra. Everybody's playing. Everybody knows the tune. It's like an orchestra. Everybody knows their role. Everything is just intertwined. Everything flows very well. That's what this document actually proposes. You coordinate things together. The state governments go. Everybody's coordinated. The national government is probably doing more of like what do you call it? More of like looking out for everybody and regulation. Okay, at the national level, you're doing more of regulation. Yes, okay, exactly. And you're bringing most of the deliverables down to the local government because that is the part that is closer to the people. Okay, but everything is well integrated. Of course, you talk about the issues of data. Okay, and making sure that you have data that captures everybody. We are still waiting to do the national population census, isn't it? Yeah. We need proper data. We need harmonization of data as well. We have data scattered everywhere. BVN on this side, your national identity on that side, and so on. Please, can we be serious? Can we actually do so? We are not serious in this country.
I know you had your stint with the UK healthcare system and the great sacrifice you made to at least come back to the country to contribute your own quota. National Health Service is what they are.
Yes, the NHS for short.
Yes, NHS. What you're saying, does this speak to the system over there where there is that integration?
That is exactly what happens. Exactly what happens. You have data. Everybody is known. Yeah. Okay. You want the address of everybody is known. Everybody's data is known. Okay. You got everybody. For example, in the UK, I'm registered with my general practitioner. That is the primary healthcare system. Yeah. I'm registered with my general practitioner. If I need anything, I go there. Yeah. If I need a referral, they refer me to a higher level. So just imagine that in Nigeria, we have about 10,000 wards. Okay. Imagine if every ward has a primary healthcare center that works like that. You have technology, everything. Everybody in that ward is registered in that place. You have all their data. You have a place you have solar capacity in terms of light. You have a borehole that has water. You have community health extension workers that are very well trained, okay, and very well regulated. Okay, very well regulated. You have maybe like a doctor in the local government itself that is supervising all of them and stuff like that. A properly integrated system, okay, that actually works. You have your mother in your village walks into that facility. She's attended to promptly. Okay, if you talk about issues of like health promotion and stuff like that, that center in that ward can actually do health promotion. Okay, anybody who goes to that place, there's a small TV that's telling you, oh, in your language, they just say, oh, do this, oh, to prevent dysentery, oh, do this and stuff like that. That is a system that actually works. And can it work in Nigeria? Yes, it can. You just need serious leaders that understand that you must put healthcare, okay, as a mainstream priority. I say this, you cannot make your 8 point at healthcare that education is not in it. You look very unserious. That's the truth. I will not take you seriously. And if you ask me, oh, come and support my government, no, you're getting it wrong, sir, ma, or whoever you are. You are getting it wrong. If you want to move millions of people out of poverty and stuff, invest in health and education. Make sure that these things actually work for the people. In fact, when you talk about good governance to people, healthcare is one of the ways that governments actually show the people that, oh, we actually care for you. Healthcare.
Okay, now one of the proposed health reform focuses, one of the key aspects of this proposed health reform is collaboration with the private sector. As we are right now, do you see people confident enough, Nigerians, investors, confident enough to collaborate with government in pushing the health sector to the desired height?
One of the first times I spoke about this Presidential Health Reform Committee report, one person said something. He said, oh, this governments, the Nigerian government is not serious. Okay, if you want things to actually happen, the private sector needs to actually take over and stuff. And I say, okay, you do have a point. Okay, and if you look around the country, you will see private sector players that in their own small scale are doing an absolutely fantastic job when it talks about deliverables and stuff like that. But question is, what is the number? What is the catchment for that? Okay, now we talk about scaling up, isn't it? 215 million people plus. Okay, like I said, 10,000 words, okay? How are the private people going to get involved in the scale-up? Okay, if the governments do not create the fundamental platforms, okay, for the private sector to actually jump on and stuff like that, it is not going to work. So to answer your question, are private investors, are they really confident? Like, oh yeah, we have very good platforms to actually invest in? So, no, there's still work to be done. There's work to be done for the governments. I agree that governments shouldn't put their hands in everything, but when it comes to robust regulation, when it comes to creating the platforms, creating the policies, creating the legal frameworks and stuff like that, they are still the ones that are still going to do it. Okay, if you let me read one thing here. So they talk about, the report proposes a redesign of the healthcare system based on 3 key principles. Okay, 3 key principles. Number 1, strong government role in healthcare. You cannot escape. If you want to provide a healthcare system in Nigeria that Joy you can be proud of, Sir you can be proud of, I can be proud of, the one that the 3 million multidimensionally poor people can be proud of, you cannot leave government out of it. Government at all levels, national and subnational level, they must rise to the occasion. Number 2, they talk about commitment to equity. Equity means, we talked about all the poor people that cannot access care. We talked about the fact that we have the NHIS previously, NHIA now, and stuff like that. So you must say, oh guys, are you serious? How many people are you actually covering in the real sense? Okay, this cover, what is it actually for? And stuff like that. And when we talk about equity, we're talking about being able, this universal health coverage, being able to deliver care to that last man in that local government somewhere, in that poor rural community. When you're able to do that, you can beat your hand on your chest and say, yes, we have done it as a country. And 13, increase the involvement in the private sector. Key principles, key pegs to actually stand up. So you cannot leave government out. Okay? Like I say, you hear private sector players, they're doing a fantastic job in private sector. You hear, well, somebody was talking about, oh, they took over a primary healthcare facility, and after they took over a primary healthcare facility, bang, 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 they are doing like 1,000 deliveries, no deaths and stuff like that. Fantastic. Okay, but what is the maternal mortality in Nigeria now? If you want to actually change those very poor indices in Nigeria and stuff like that, no, government, no, you must be involved. And that's why we must continue to put pressure on them. We must ask them the right questions. We must ask them, guys, why are you doing an 8-point agenda? Healthcare and education is not there. Why is it that the former government did a fantastic job, a very good job, brought out this Bible or Quran of healthcare? Why are we not hearing about it? Why have you guys not started doing work on it? Okay, is it because, oh, there's a tendency for people to think more about, oh, they've increased fuel, oh, this fuel is high, oh, the economy is bad. Is that what? Are those the only things that you're going to actually focus on? It's only the things that you think that. So that's why I'm calling on Nigerians, all the key players, the Nigerian Bar Association, all the healthcare professional associations and stuff like that. Can we please, the media, okay, can we please continue to talk about these things? Okay, very, very important.
Okay, well, you have mentioned something very important, and one of these recommendations is talking about establishment of a healthcare reform legislation. Yes. And you sound like it is, we need it like yesterday. However, we know what it takes to have a legislation in Nigeria. It takes a lot of lobbying and all of that. Have we started? And how can we engage? Yeah, people like you who are advocates, how can you engage with this, your representatives, to ensure it is pushed and pushed fast?
So we talk about the key players, isn't it? So who are these key players? Key players normally should be everybody, but we can pull some out. The health professional associations across board. Okay, I will keep calling them out. The Nigerian Bar Association, they are a very strong force. Okay, first of all, health is a right. Okay, so even from the legal perspective, they should be coming from that area and actually pushing. The individuals in the Nigerian Bar Association, they should not forget. The problem is that it is when they actually have a healthcare problem, they don't remember, our hospitals are really bad. Oh, our primary healthcare system. Okay, no. Please be part of this. Okay, all the key players, like I say, healthcare professional associations, the Nigerian Bar Association, the media, the civil society organizations. Okay, unfortunately, when they go patient advocacy groups, okay, we don't have that much in Nigeria. But I think we need to start having more patient advocacy groups. Okay, all these people need to keep pushing and pushing at all levels, at the level of the executive, at the national and subnational level, and of course at the level of the legislative, also the National Assembly, and also the state governments. We should start pushing for this. We should keep reminding them. Don't think that because you have the resources to actually go out of Nigeria and stuff like that. Even you yourself, that you think you're a big man or a politician, the day you actually have an emergency, there's what they call the golden hour. I don't. Where do you normally go to? South Africa, Germany, Dubai? None of them are within 1 hour of Nigeria. And of course, we all know stories of big men politicians who have died because they couldn't move. So the fact is also in the best interest of the politicians, both at legislative and executive levels, that we actually have a healthcare system. And
that
guess
works.
what? Guess what? One of the things I always say is that even from a political standpoint, the fact that, for example, if this government can, if they are serious, in 4 years, deliver a primary healthcare system, a basic healthcare system that is worth its salt, in the 10,000 wards, okay, that every individual that can go into come and say, oh wow, yes, oh, they treated me very well and stuff like that. That is a political strong point, okay. You can even campaign with that. Okay, even from a political standpoint. Yeah.
Well, the COVID-19 pandemic, it revealed some very interesting.
Some of things that we knew already, but it's just sort of
okay.
How do you say we profile yash open?
So, it was an eye opener to a lot of people about where we were or where we still are with regards to healthcare provision in Nigeria. And then I can't remember the name exactly, but there is this 1% fund from the consolidated.
So it's called the Basic Healthcare Provision Fund.
From Basic Healthcare. How far are we on that? Because we're still talking about funding.
So again, see, one of the major problems we have in Nigeria, when you talk of white papers, legislations, policies, we have them plenty. We are very intelligent people. Okay? What is usually the problem? Political will and muscle. Okay, the ability to take things that are in paper, for example, this report, good report, well, it's going to remain a good report on paper until the people who should be doing the needful do the needful. Okay, so the 1% basic healthcare provision, okay, most of it is, there's a way they actually spread it. Oh, this should go to logistics and stuff, and institutions that actually help you to organize and stuff like that. A part of it should go to actually providing the healthcare itself and stuff like that. 1%, is that enough? You know, it's so sad, okay? To almost 2 decades plus ago, in this same Abuja that we are, you had the Abuja Declaration. In this Abuja, all the African governments, and one of the things was like, hey, let's push towards having 15% of the budget towards healthcare, because actually healthcare is actually that important. Where have we been since? Somewhere within 4 to 6%, an average of 5%.
We're still moving.
Because healthcare is important is not important.
To some people, right?
Yeah.
To those who it should be important.
For many people, it is not important. Okay? And so, for example, one of my proposals, personal proposals, that basic health provision fund should go up to 10%. That's number one. Number two, I feel that I would strongly advocate and advise that in a stepwise manner, okay, over the next 4 years of this government, roughly we're about 5%, isn't it? Usually. Yeah. Stepwise manner, 2.5% addition every year. 2.5 times 4, that's 10, isn't it? In 4 years, you get to 10%. Okay? So that's where. So the 1%. Yeah, has it helped? Yeah, sort of ish and stuff like that. Okay, but we need more. But of course, there's one issue of actually increasing the funding. There's the other issue of the first thing they're talking about, governance and leadership, and what? Institutional reform, because we want value for money, isn't it? We want things to be cost effective. We want things to be more efficient. Not the one, there's another issue again. The problem in this part of the world, we always think that when you carry money and throw money at something, automatically solve the thing. That's a lie from the pit of hell.
Well, I think we should be hopeful with a renewed hope agenda. Because if you remember, the OVERHAUL report for civil service reform that have been in the dockets for ages, we're beginning to see its implementation, which of course is translating into some directors that have been sitting tight, even after the expiration of their legally approved term in office, are now having to give way, even when they don't like it. So we hope that this report by this committee, which has been submitted to this present government, does not also go into the shelves
or take as much time as the OVERHAUL report.
Begin to see implement. We have to say a sincere thank you for always being there.
Nigerian patients are
from me personally, for your passion, especially for the Nigerian patient and your advocacies at any time you are called upon. This man, I sometimes call him 12 and he was always there. If you will make it, he will let you know. If you won't, unlike other people that will call and it's
Nigeria is a great country, and when it comes to actually pushing healthcare, we can actually do it. We just need to put pressure, work our positive pressure. Like I said, the Nigerian patients.
Thank you. Thank you so much for being part of the program. Dr. Douglas Okor. It's always wonderful, like Usman has said. But this is where we will end this segment to start with our Investment Plus segment. And after that, we have another interview. So stay with us. It is still ASU Morning.